Welcome to the Mama Making Podcast, a space for moms figuring it out in real time, at home, at work, and everywhere in between. Hosted by me, Jessica Lamb, this show is here to help you feel a little less alone in the mess and magic of motherhood. Each week brings a mix of solo reflections, expert interviews, and real stories from moms leaning into themselves, whether that's into parenting, into entrepreneurship, or just surviving the day. Because there's no one way to do motherhood, and you don't have to do it alone. If that sounds like your kind of vibe, make sure to follow the show, share it with a friend, and keep showing up, exactly as you are. This episode of the Mama Making Podcast is sponsored by Collabs Creative. If you're a mom building a business and trying to do it without a roadmap, you're so not alone. That's exactly why I started Collabs Creative, to help founders like you tell your story, grow your brand, and actually connect with the people you're meant to serve. From social media strategy to full-on content creation, we do grassroots marketing that feels real, because it is. If you're ready to stop throwing things at the wall to see what sticks and start showing up like the founder you already are, head to collabscreative.com and let's start building something good. Now let's get on to the episode. Hello, everyone, and welcome to the Mama Making Podcast. I'm your host, Jessica. If you're new, welcome. If you're not new, then welcome back. Today, I'm super excited to have Dr. Sam and Dr. Amy on the podcast to talk all things cash-based care. Dr. Sam O'Brien is the chiropractor and founder of the Hive Wellness Center, a holistic practice dedicated to supporting women and families through every stage of life, from pregnancy and postpartum to pediatric care and beyond. She's passionate about redefining what chiropractic care looks like, offering longer, more intentional appointments that blend hands-on care, functional strength training, and individual rehab. Treatments often include soft tissue techniques and whole body approach designed to restore movement, balance, and confidence. I'm also excited to have Amy Fetch. She is a women's health and pelvic floor physical therapist based in the Barrington, Illinois area, and the founder of Chicago Mama PT. With a focus on full body holistic approach to pregnancy support and birth prep, postpartum recovery, perimenopause, and menopause support, core and pelvic health, and functional strength for motherhood. Amy helps women move, heal, and feel at home in their bodies again. Her cash-based practice allows her to provide one-on-one sessions and individualized care that supports the whole person, not just the diagnosis. Thank you both for being here. I'm so excited to have you.
Thank you. I'm excited to be here.
Same here. Can't wait.
So we'll just get off and running. Our focus today is cash-based care and how it can benefit us as patients. And I think this is a really important conversation to have while we're in like a really weird space in history where cash-based is starting to kind of creep in and be kind of a change maker for healthcare. I know a lot of us struggle with our current system of insurance-based, and I am super excited to hear your viewpoints and expertise in both cash-based and insurance-based and how it can benefit other people. So with that said, I would love to start out with you guys sharing exactly what cash-based care is for the average person tuning in who might not know. Amy, do you want to go?
Yeah, sure. So cash-based, I feel like a lot of people get confused by that. It doesn't necessarily mean that we don't have some relation, or not that we don't necessarily have a relationship with insurance, but we still can use insurance. We can use your HSA, FSA. We create something called super bills, which are just detailed receipts insurance companies use, and they can reimburse you directly. What it ultimately just means is we work for you as the patient. We don't work for your insurance company. When you're in an insurance-based model, the person that is paying you is insurance. That's ultimately the person you work for and kind of dictates your care. And people in insurance companies aren't always healthcare providers. And so you have people in business that are telling us of, oh, this person only gets 6 visits for this diagnosis, or you can't treat them for pain with intercourse, but you can treat them for back pain. Like they choose what diagnosis codes get treatment, what don't. So really when we talk about cash-based, it's just we're collecting payment at time of service, and we can still use insurance in a different capacity.
Yeah, that's perfect. Dr. Sam, anything else to add?
I think it also comes down to just the differences. Yes, with super bills, sometimes there are varying reimbursement pays. That's a little bit different, especially in my world with pediatrics. I know pediatrics can get a little bit unique, but overall, like Dr. Amy was saying, is that you'd still get to utilize typically some sort of insurance. And a lot of our patients use the HSA and FSA side of things. And then some of my patients have great access to super bills. So they're able to utilize that and they get great reimbursement as well.
Yeah, that's great. That's another end of it. I think people don't really realize as well the impact that it's having on the practice or your provider in addition. So moving on from that, what inspired you guys to build your practices in a cash-based way? I know, Amy, you started off in insurance-based and made a pivot to cash-based. Dr. Sam has always been cash-based. Amy, do you want to talk about your experience moving from the insurance-based to cash-based?
Yeah, so I've been practicing for a long time. So I've been in a couple insurance-based models. I've been in an insurance model where we accept almost all insurances. So we have very short appointment times, around 30 minutes, but a patient will be there for an hour upwards, but they're working with a tech or an aide, which I love the techs and aides that we used to work with. They're trained to their best capacity, but they're mostly college students or people that are interested in the health and wellness world, but they're not trained professionals with a doctorate. And then from there, I moved to a different insurance model where we were very restrictive on the insurances we accepted. So that allowed us to have more appointment time. But it's different. When you're in an insurance model, your insurance is still dictating your care. And so after being in that, like treating in that capacity for 9-ish years, I then opened up my own practice and decided to go cash based just so I could provide better quality care that I can dictate how many visits someone needs with the collaboration with the patient. We can treat whatever diagnosis that's coming in. We can also work on wellness. Like when we think about pregnancy care, like we'll treat your back pain, we'll treat whatever pains are coming up, but then we're also going to work on like birth prep. Well, that's more considered like a wellness component. And sometimes that can get kind of cloudy in the insurance world. And we can get you to your ultimate goals. We don't have to just reach to like, oh, you're functional, you can walk community distances, you're no longer qualified as medically necessary. We can get you back to running your marathons. So the care is just much more individualized to the patient. It's much more based on their goals than insurance's goals. And it just allows me to spend more one-on-one time with patients, better quality care. And ultimately, overall, people are getting better faster. They're feeling seen, they're feeling heard, they're not feeling dismissed or rushed through an appointment. I just feel like you can connect with your patient so much more and you get better quality.
Yeah. Was there a pivotal point for you when you were like, okay, I have to do something different?
Yes, I definitely, when I was in the insurance model where we were accepting most insurances, I thought I was in the wrong profession. I did not like what I was doing because I was just seeing a patient every 30 minutes. I would quickly like, hey, how's your day? Okay, cool. So what are you coming in with? Okay, we have to address this. Okay, quick. And then I'm quickly writing down the exercise you have to do and handing you off to a tech. And sometimes the gyms would get so busy, I wouldn't even be able to see that patient. Or I'd be looking at them across the room and be like, oh my gosh, what exercise are they doing? I don't like what they're doing, but I have another person here and one person waiting over here. And I just feel like I was being pulled in so many directions, or someone would bring something up. I'm like, ooh, that's probably part of your back pain. It's very lifestyle focused. That I don't feel like we even can start talking about, or your shoulder is going to play a role in your back pain, but your diagnosis codes are only for back pain. We can do a whole nother assessment in a different session if we want to start treating your shoulder. But it's like, well, you're one person. Your shoulder might be connected to your back and your foot's going to be connected to your back. And that's when I decided to get out of the like, I have to change something. I can't be seeing 15 patients, 18 patients a day. And then just being in the other insurance model, I still just felt like I couldn't give that holistic, it's just including the lifestyle management and stuff like that as much. That wasn't as pivotal. That was more, if I really want to treat the way I want to treat, like I have to change something.
Yeah. Dr. Sam, you guys just celebrated an anniversary at the Hive. How did you guys both decide, okay, we're doing cash-based?
Yeah, so we originally had ventured right after school into Austin, Texas. So we drove down there and we immediately were already working as associate providers in a cash-based clinic. So both Dr. Kim and I worked in separate clinics. We got experience with cash-based pay. And I knew right away that that's kind of what I wanted to do, whether I was an associate or I worked for myself from the get-go. Long story short, we got to Geneva. We opened. We're a little over a year old now. And I knew right away that's exactly what I wanted to continue to do, was keep up with that cash-based pay. Like Dr. Amy was saying, like it really dictates what I'm allowed to do with you and how much time I get to spend with you and the quality of care that I get to provide, especially in the chiropractic world. We really only get reimbursements for really basic things, the adjustment itself, and then Most providers do maybe a little bit of like a heat or an ice pack and maybe some soft tissue or a TENS unit or ultrasound. Other than that, we really don't get reimbursed for any type of rehab exercises, or it's really, really horrible reimbursement rates. And with the way that I practice, I am very different than your typical chiropractor. I'm not just adjust and send you on your way. I really, once again, enjoy spending time with my patients. I am a talker myself, so I need more time myself to be able to spend with patients, but also there's such a area that we're missing on, I think, our chiropractic side is we adjust, but I don't believe the adjustment is the thing that fix the problem. We have to figure out why those things are getting restricted. Why are the joints restricted? Why do you keep having this pain come back? If we don't address the functionality of what your day-to-day consists of, then we're never going to be able to fix it. And you're just going to get trapped into this never revolving door that I feel like chiropractic is so known for. And that's just come in two to three times a week or once a week for the rest of your life. And that's not what I think. We're just missing such a huge portion of our care with that. And then also just reimbursement rates for any provider listening to the podcast. They're also reimbursement rates are just awful. That's why chiropractors get sucked into 5-10 minute appointments because they just truly do not make enough money to keep their doors open when they accept insurance. And I constantly say this, it's not necessarily the provider's fault. I think the system just gets them trapped into this. Like they just don't have the opportunity to get out unless they go cash. You just don't get enough money to keep your doors open as a provider and feed your family.
Yeah. And to your point, Dr. Sam, like even in the PT world, reimbursements actually going down as like inflation goes up. So providers are getting paid less and less. And I remember at one of my practices, we had a consultant come in and she taught us how to like play the game of use this code, then use this one, but 2 of here, 1 of here, because it's like a game to get reimbursement higher because insurance companies are just, they make it challenging. And yeah, it's something will eventually, hopefully change.
Yeah. Yeah, I think this is the perfect point to kind of pivot and talk a little bit more about what this all looks like in practice and how does it impact the patient experience. Whoever wants to go first and share what a session might look like. You guys were mentioning you just kind of do the crack and send them on their way, whereas now you're able to spend more time with your patient. What does that entail?
On my end, like I said, yeah, I think the adjustment's a great tool. I know a lot of physical therapists are starting to implement a lot more of like manipulation in their practice as well. I think the two professions, I hope in the long haul, kind of meet together and really start to like work together as a team or become kind of one. I know some chiropractors are not for that. I personally think it would be a really beneficial thing for both of our professions because I think, once again, all those tools are incredible. But for me, I've had a few, even just recently, new patients come in from other providers where they are used to more 5-10 minute appointments. All they get is an adjustment, a hi, a bye, and see you later. They're on to the next room. And when I mentioned that, like, hey, your follow-up appointments are about 30 minutes long, that's about as the minimum amount of time that I like to spend. In my perfect world, I'd spend an hour. I wish I had sometimes more time, but in general, we offer anywhere from 30 minutes, 45 minutes if we need a little more time with our patients. And then our new patient exams are at least an hour. And then outside of that, we sometimes have one-offs where, hey, yes, an adjustment's great, but I do think rehab is going to be the thing that actually starts to change your pain for you. So maybe we do get a few adjustments, some soft tissue, and some really basic rehab to start at home. But as they start to come in for maybe a visit or two, and I'm realizing that the joint dysfunction and movement is going really well, and that doesn't need to continue to be adjusted constantly, then let's transition to working on whether it's strength, stability, mobility, all kinds of different things. It just really opens up the door for me to work on so much more than just your spine, because we really truly can treat so much more than that. I always like to use fun examples in my pediatric world of like, we treat latching difficulties, body tension, constipation, pretty much anything you can think of. We typically at least can address it. And then if we think that there's a more significant piece that needs to play a role, I will absolutely refer out to pediatric PT so they can get more in-depth one-on-one hour-long treatments and care, because that's what they specialize in. I might be able to give you like a few things to do at home, but in general, if those aren't nipping it in the butt, then it's time to look and kind of collaborate with other providers, which is where I think our system in general is failing patients, is we don't talk to other doctors. So then everyone's just treating one thing at a time, all separate occasions, instead of looking at the whole system.
Yeah. And to Dr. Sam's point, I feel like treating in this model gives me more time period. I don't have to see as many patients in a day. And so I actually find I do collaborate way more as a cash-based provider than I did ever before. Not because my philosophy on it has changed. I just have the capacity to actually give her a call or text her or be like, hey, I'm sending over this patient to you. Patients are like allowed us to talk about them. Like, here's what's going on. Here's what I would love for you to look at. Give me your opinion. Because I love collaborating, especially like with the perinatal population with chiropractic. But yeah, I agree. I feel like very similar. Like a session for me would look quite the same. There's hands like we'll do an evaluation. There's hands-on component. Obviously, with pelvic floor PT, like if there is a need for any internal treatment, we'll definitely assess that with the patient's consent. We'll be looking at like hip mobility, back mobility, your breathing mechanics, everything from like even your neck posture is going to affect how you're breathing. We'll look at how your foot is hitting the ground because that's going to change how your hip is functioning, and your hip and your pelvic floor play a role. We're going to talk about lifestyle stuff like you're a new mom, like of course sleep is going to be a challenge for you, but like how much sleep are you actually getting? Because that's going to play a role in your pain. That's going to play a role in like your digestion and all that kind of stuff. So we're going to look at like what's your sleep quality like, and if we find that there's a lot going on there that's outside of just like baby waking you up, then we'll refer out to someone that can support you in that capacity. I'll look at very basic nutritional stuff. So if someone's having constipation, like what does your fiber intake look like? If it's something that requires more, then we refer to like whether it's a functional nutritionist or something of that capacity. And then I like to talk about like stress management just because your nervous system plays such a big role in how you're functioning. And that sometimes we're like referring to acupuncture or maybe a mental health therapist if we need to. And then movement is like the big part with like the PT, the chiropractic that we really get our hands into. But all of that has to be functioning together. And I feel like that's something that I have found. I've invested a lot more of my continuing education and just interest in like that very holistic picture. Because I have found that now that I have the time to actually sit down with a patient and talk about all aspects of their life, I'm like, oh, they're actually getting better quicker because we're addressing all these other things. And that chronic pain you had, if we don't address the inflammation in your body, what you're going to do with your functional nutritionist or your functional medicine doctor, we can't really get your PCOS or endometriosis under control and control your pain with that. So yeah.
And to even go to your point that you were saying earlier is I think some people don't realize like all that we can treat, and like pretty much I say anywhere from literally head to toe. And like you were saying earlier, I working with prenatal population too, like you said, foot and gait mechanics plays a huge role in your pelvic floor for your jaw clenching, all of that. And it's really fun to sometimes be like, you know what? You take your shoes off and you look and you're like, oh, there's bunions, hammer toes. You trap your feet into these super narrow shoes every day to go to work. And I have this conversation daily of like, your feet are like literally the thing that contacts the floor all day long, every day as you walk around. So it's super fun on our end too, to be able to address the whole body and not just get limited to what insurance. Oh, you just have low back pain. So if you have low back pain, all you get to treat is that and nothing outside of that, which is where even on my side with insurance, if I adjust your low back, typically I can't do soft tissue on the same area of complaint on my end for a chiropractic, which seems crazy because it's like, that's the area that hurts. Wouldn't you want soft tissue on the area that's the problem? So I find that being able to be cash-based, you're able to address so much more than just the one area and that little circle on your oswestry that you have than everything else in between.
Okay, I would say I've been practicing for almost 12 years. In the last 2.5 years, I've been in cash-based, and I feel like I have learned more as a PT in the past 2.5 years and like grown my confidence skill set than the previous 10 years, which is, or 9 years, which is just wild. And I think it's just like having the ability to collaborate with other people, having the time to actually research stuff, having the mental space to not have to be worrying about arguing with an adjuster about like, I've had fights with someone on the phone. I'm like, are you even a provider? Like, you're telling me this patient's no longer qualified for care. Like, this is all the things they still can't do. I'm like, not having to do that just gives me so much more, not even just like time, but mental space, like mental capacity to like then research and look things up about what's going on with this patient or what else could we be doing.
That's the perfect segue into what I was going to ask was, it sounds like there's a huge component that's missing in patient education. And obviously that's got to be a time factor in explaining like how all these different things connect. I have always gone to chiropractors, I've done PT, and never did I get more education than when I went to a cash-based physical therapist for pelvic floor, that I was like, oh, this all connects. Like my back pain is because of my pelvis, or my chronic hip pain from however long I danced in my past is connected to my pelvic floor as well. So like there were so many things that I was like, oh, I didn't even realize. And it was simply just because she had the time in her schedule to be able to educate me. And then same for my perinatal chiropractor. She had the time to be like, this is how your body is growing, and this is the mechanics of what's happening while you're growing this baby. I imagine that it's the same for you guys, that you have so much more time to educate your patients on this is your issue, but here is, or this is where your pain comes from, but here is where that can be stemming from, and like just basic body mechanics.
No, totally. And I feel like also in a cash model, like the patient's invested and we're invested. When you're using insurance, some people see that as like free money. And so it's like, oh, I'll come 3 times a week. I'm not even thinking about why am I even coming? Is it helping? I don't know, but my insurance is paying for it. But when you're paying out of your pocket, maybe you'll get reimbursed. I'm not sure. But when you're paying out of your pocket, I know you're invested and I want to make sure you understand why this is important. So I'm going to make sure that like not only it makes sense to me why we're doing X, Y, and Z, but I want it to make sense to you so you can take the ownership of this, and because you're invested in actually wanting to get better.
Yeah, I literally just had this conversation with a patient yesterday. She kind of came in, thought she knew exactly what she needed. She's like, I need, chiropractic care every 3 weeks. That's exactly my bread and butter. That's what works. Otherwise, my hips, everything goes out of whack. And I kind of asked her, like, okay, how long have you been doing that type of care plan with your other provider? And we kind of dug deep, and she's been doing it for like 5 or 6 years straight of just every 2 to 3 weeks, she goes to gets adjusted. She waits too long. Her body feels like crap. And I kind of told her, like, look, I can absolutely do that. It's not to say I can't, but I feel like I could offer better. I feel like we can address the fact that as soon as she got on the table, I'm like, you have instability. Your SI joints are like butter. The moment I touch them, they just like have so much give to them. And that's a joint that shouldn't move a whole lot. And so it's like, I think we actually need you to start like not sitting all day. We need to get you up. We need to maybe modify our workstation. How is that looking? Are you sitting all day? Are you standing? Are you changing your sitting surfaces? It's just great to be able to have the time once again to break all of that down, and then, give her some things to start strengthening the glutes and the pelvis and everything in between, so that she doesn't keep just having this never ending cycle of, I got to go in 2 weeks is hit. It's right on the dot. And it's just sometimes frustrating on our end too. And I know, Dr. Amy, you probably feel that too on the PT side of like, it just really ruins the quality of care that a patient can receive because they don't have enough time. They're seeing 5 patients in 1 hour or however many, and you're not able to give your full attention to that person who is also, once again, still paying a copay if they're going to an insurance-based provider, and they're taking time out of their day. And it just can be very frustrating to see these poor people fall through the cracks in the system. Just think that, oh, I guess I just have to deal with this for the rest of my life. And it can be very frustrating on the provider end to be like, no, there's so much more. There's so much better. And once again, it's not to say that it's the provider's fault. The system really traps all of them into it. But it is a very frustrating world right now in that insurance-based care.
Anything else on that, Amy?
No, I mean, I agree to all that. I've been in the model before. When you don't know any different, it's kind of just what you do and people around you are doing it and it just seems normalized and normal. But once you get out of it, you're like, oh man, I got to show everyone the other side of this. But yeah, I mean, I feel like if patients are getting more out of one session, they're not going to have to do as many visits. Like I would say most patients I see are 1 time a week, if even that, depending on where they are in their plan of care. Occasionally, if it's someone that has more acute pain, it might be twice a week. But if you go to some insurance models, I mean, they're seeing patients 3 times a week. And that's often because they need to have enough patient volume to make ends meet. But also, they only get 15, 20, 30 minutes with a patient. And so they have to spend so much more time to dive into all these details if they even get to those details. Where I feel like in our capacity that Dr. Sam and I can treat, like we can cover a lot in an hour session or half-hour session. Like you can definitely give so much more information during that time. That they'll have to come less frequently. They often get better quicker because we are addressing all the different components of their health. And yeah, so I mean, some people ultimately in cash-based settings can save money, especially if they have a high deductible plan and save time. So I feel like educating people so they're educated consumers and they can pick what works best for them. And some people like insurance is the only option. They've paid a ton of money for their insurance. They really want to use it. They've met their deductible or whatever their financial reasons. Like, and I'm sure both of us like totally respect that and we understand that.
Absolutely.
But if you have the capacity, like I do think your time's better invested with a cash-based model. But just like anything, there's good providers in cash-based models, there's bad providers in cash-based models. There's good providers in insurance-based, there's bad providers. Just like there's good accountants and bad accountants, you know?
I was just going to say, I've been just speaking with patients when they come in who have finally decided to take the jump and the leap of faith to try cash base. Talking with them, they're like, oh, wow, I was had a $30 to $50 copay depending on insurance for their 5 to 10 minute appointment. And they came to like our practice, which once again, another thing, I always make our prices very open and clear. It's on our website, or people can call and ask more questions. There's no hidden cost and fees where ours are $75 for 30 minutes. So yeah, it seems a little bit more expensive, but you're also getting so much more time. And it ends up being like once again, like so much more cost saving. Or with us being cash based, I try to implement things like almost like a gift card that if you can maybe fill your gift card allotted money up front, it discounts your visits each time you come in. So instead of the 75, you get like a 10 to 20% discount, depending on how many visits you want to buy up front. So I try to find ways, or you can do like a monthly payment. Luckily for us, we get to kind of do whatever we please as a cash base. So we can really try to meet our patients where they're at. And, sometimes there are certain situations where being able to have the freedom to accommodate someone is super amazing. And it's awesome to be able to help other people who may be kind of like stuck in a bad situation in the moment.
And I feel like, so I don't know if I said like exactly what I treat, but I treat a wide range of conditions from pelvic pain, like PCOS, endometriosis, to pregnancy, postpartum, perimenopause, menopause, any bowel, bladder, painful sex, anything like that. And I find that especially the patients that have like endometriosis, PCOS, that have like very painful periods and a lot of that pain, those people are a lot of times just dismissed so much in the traditional healthcare model because what they have is complex and kind of also a little like non-specific pain. It changes and it's hard to wrap your head around, and they downplay it because they've been dismissed so much. And I've had a patient recently who was like, no one's ever made me feel comfortable, like being able to tell them everything that's going on and like asking more questions and not being like, oh, is it really that bad? Like actually diving into it more because I have the time to like ask them about those questions and to support them. Um, Definitely for like those involved patients too, I find being in this model is really helpful.
No such thing as TMI. I always tell patients, like, if they're talking about their bowel problems, I'm like, okay, tell me more about it. What does it look like? How much are you doing it? Like, let's go into more detail. And same thing when it comes to like your cycle and things. Like, it's not something I personally specialize in, but I like to ask more so that I can hopefully connect them to once again and collaborate with the right provider for them. So being able to once again have the time at the end of the day, I feel like it comes down to time, being able to have the time to be able to ask those questions and not just be like, oh yeah, we'll just, here's this, take this, see you next time, we'll see how it goes. But be able to break it down in more in depth, I feel like once again just serves our patients so much better.
And there's so much value in just feeling heard.
Yeah, that's exactly what I was going to pivot to. I feel like we're in this really unique intersection of women, specifically, and moms craving this like higher quality care, being listened to and having their symptoms validated and have a better understanding of the whole picture, while also having more providers speak out about what it looks like to work with insurance companies. There's been a ton of doctors on TikTok. There's one specifically that I follow who is a cancer doctor who works with women who have breast cancer and does reconstructive surgery. And she has like blown it wide open about what it looks like for her as a provider to try to fight for her patients. And then we also have the other side of it where so many of us patients are also having to fight with insurance companies or got screwed over by their insurance company because they needed a pre-authorization or whatever it might be. They expected something was going to be covered and for whatever reason it wasn't, or we're paying astronomical premiums, so much so that we can't even use our benefits because we don't have the money to pay a copay. So I think we're at this weird intersection that I think is a really great opportunity to continue to have these conversations where everyone can feel validated in what their experience is. And then we can kind of start to change as providers and patients, change what our expectations are of whether it's insurance companies or just healthcare in general, that we have an expectation for what we want it to look like.
Absolutely. I was just about to make that same point is sometimes people will go in, they expect to get certain things covered, and then they go through either the procedure or the appointments, and then they're slapped with a huge bill at the end because they actually weren't covering all of the things that they were expecting to have covered, which is also very difficult too. Like at least with the cash-based model, you know right away up front exactly how much you're paying, what you're paying for, and within our model specifically, everything we have to offer is included in our appointment fee. There's no additional fees, there's no tack-ons, whether I do dry needling or I cup. Doesn't matter. I am still able to give you the one size fits all fee, and we get to dictate that care based on what's going on for the day. And I think that that's a really big eye opener too, is you expect certain things to get covered. Your insurance says they're going to cover it. And then there's one little tweak. And then all of a sudden they're like, oh, nope, we don't cover that. You have to pay the extra couple hundreds or thousands of dollars that they're no longer going to cover.
Yeah, I agree with that. I feel like upfront, at least that's how I'm set up, similar to Dr. Sam, like upfront exactly how much each session is going to cost. There's no like I do dry needling. A lot of places because insurance doesn't cover it, a lot of places will have an extra $25 fee each session that you do dry needling. To me, I'm like, the needles aren't super expensive. Like, I don't know why they're charging so much more, but maybe because I can't charge for that time. I'm not sure, but I'm like, it's just part of the session. Like, we might do one needle this time, or if we're doing C-section scar, like we might use 10 needles because we're putting it all along it to try to break up that scar tissue. The price will be exactly the same. So it's like, well, do I really want to do that or do I not? Like, how beneficial is it going to be? It's just one flat fee and you know what you're going to pay each time.
Yeah, I think we all could have some examples of times that we were like, oh, I thought this was going to get covered and didn't. One of the huge ones for me and my family, which made me start to kind of prioritize learning more about cash-based, is when my son was born. We had an unexpected NICU stay, and because coding was done incorrectly, a good amount of our visit or stay in the NICU was not covered. I mean, as consumers, how would we know what to code, what to ask to have coded? So we did our premium for the year and then wound up spending probably triple the amount we should have for the emergency care that we received. So for me, it felt like it was a pivotal point to be like, okay, what is this? And I know a fair amount about insurance in general, but then it wasn't until we were paying a very large hospital bill that I was like, okay, something has to change. And a lot of times, I think more and more people are having this experience where they're asking their providers, what is your cash rate? And I have found in my experience that a lot of times the cash rate is less than what your copay would be if you were using insurance. And so my biggest piece of advice is for people to first ask what the cash-based pay is or self-pay rate, and then decide what your care looks like from there. Because I think we've all been in this position where we're like, I thought this was getting covered. It's not. Now I owe significantly more than I would have. Do you guys have any like patient experiences or like anecdotes from other people that are like, yeah, this is kind of how it's going and where we're moving to in a cash-based world?
I feel like it's just being willing to ask the questions and then spend the time on the phone waiting with insurance companies. Like if something's not covered, ask them why. And then if you talk to someone else the next time you call, they might give you a different reason. Then you can call back to the provider and be like, hey, they said it's not covered because of X, Y, and Z. Do you know why that wouldn't be? And you will be playing the game, but eventually some of it will get covered. I had a patient that used to be a doctor and she hated the insurance model. And so she then worked for insurance companies thinking like I can change it from the inside out. And I forget what the number was, so don't quote me on this, but it was some percentage that was significantly high. I forget if it was like a quarter or 15% or maybe even higher than that just get declined for no reason because they know no one's going to look at it. And then if people look at it, question like, well, that must have been an error and we'll change it. But yeah, so I mean, it's one of those things that like, who has the time to sit there and comb through their insurance stuff? But like, you kind of have to. And so it's just being aware of that. And then, like, to your point, if something doesn't get covered, I would then ask them, like, hey, what is your out of pocket rate? Can you just take this off the insurance billing and I'll just pay you the out of pocket rate? Because typically people charge insurance companies much higher rates because insurance company, they might have negotiated that they'll only pay 50% of whatever they bill the insurance company. So they might bill the insurance company $500, but really they're expecting like $250 back, and then their cash pay rate's like $200 because they know the game. Like what you were saying, just ask what their cash pay rate is even after it gets denied. They might reimburse you or change the payment.
And same thing on my end. Like, for example, I had a family member that was looking to get a medication for MS. And the insurance companies literally denied the medication and said, you have to try 5 other medications before you can try the one that your doctor's recommending. And I know that can be extremely frustrating for patients as well, as it's like, my doctor is the one that's treating me, knows me, and is the doctor at the end of the day. And then I have someone behind a phone or a screen telling me what I can and can't do. And that can be extremely frustrating, especially in a vital time in their life, whether it's a health scare or they've been through the ringer of providers, because typically in that system, they don't communicate with each other. So they're trying to piece together all these different puzzle pieces, and they see so many different people and no one's collaborating. And now they have spent 5 years down the drain and money down the drain of copays and deductibles. And then they find cash base and end up probably saving money on that route down the, like, at the end of the day. But it's frustrating after you've been through that system to then typically find us, is how a lot of times it does happen for people. It's just very frustrating for them. And I feel for them, and I wish I could scream from the rooftops, like, just give us a try first, because a lot of times we could probably be a heck of a lot cheaper and more cost saving for a lot of those people. Not on the medication side, but on the physical exercise, all that side, yes.
I think that's a good point to ask. Do you guys have any misconceptions or myths that you want to bust about cash-based pay?
I'm trying to think. I think a lot of people do think it is more expensive. And I know Dr. Amy made that point earlier, is a lot of times those insurance-based providers, in order to keep their doors open and pay their own bills, they have to see you more frequently, which once again, if you, let's say, take a $30 copay, you're doing that 3 times a week. You're spending what, $90, when my one visit a week is 75, and I probably spend the same amount of time with you, if not sometimes more, depending on the type of situation. And you typically have to see me less. And I think we all know time is money. And now you're spending more time in the car driving to the provider. You're spending money sitting in the waiting room, and then you're spending money there. Think about how many hours, if you have to go 2 to 3 times a week, are you wasting? So I think that's a huge thing to think about too. And in my world with pediatrics, I do find a lot of pediatric chiropractors see kids a lot, like 4, 5. I even know some providers that ask to see kids every day. Who truly has the time, money, and energy to do that, especially with a newborn, or you have 3 other kids that you're taking care of on top of it. It's just very unrealistic, and I just find it very difficult for the families to be able to manage all of that. So my biggest myth is, like, most of the time we're not more expensive, and if anything we're saving you more time and money, and I think all of that kind of speaks for itself.
Yeah, I don't have a whole lot to add to what Dr. Sam said. I mean, we accept FSA, HSA, we provide super bills that you can submit to your insurance. And submitting a super bill, I've done it many times myself. It takes 5 minutes to do the first time. Sometimes can be a little confusing, and I will walk the patient through it if they want me to. But it's not a hard process. So, I mean, it's not that we're anti-insurance. We rather work for you and not your insurance company, and just build
Yeah,
that
I love
different
that.
relationship.
Yeah, for sure. So I think one of the things that obviously when you're prioritizing doing cash based, it's a value of being able to like prioritize your health and your wellness. What are some of the things that go beyond just the cost in terms of empowering your clients and patients to be able to advocate for themselves and know more about what's happening in their bodies and what they're feeling just by validating and educating? What are some of the outcomes that you're seeing from this and how it has changed, I guess, access to this kind of healthcare?
Definitely. For the pregnancy population, being able to incorporate like the birth prep. I'll work with people the first time I see them, even if it's in like their first trimester, I'll talk about like, what's your birth plan? And if they're like, well, I want to have an unmedicated birth, but I'm at this hospital, my provider kind of asking these questions, I feel really uncomfortable doing it. And they've kind of given me a little pushback. Like then just encouraging them, like, okay, why are you with this provider? Or let's ask these questions, see how they respond. And so just starting to like teach them to advocate for themselves and finding like you can shop around for providers. If you find a provider that you just like, you like them, but they don't really like fit exactly what you're looking for, call somewhere else. Like that's okay. So just empowering people to like, you can take control of your healthcare just like you get to pick what restaurant you go to. You can pick what hospital you have your baby at or what birth center you have your baby at or whatever it is that you want to do. And then being like, I feel like that in itself just empowers patients to then just take control over their care. And once you start seeing, like, I know from a personal level, like even my own husband was having some like GI related issues and he'd be fine with me sharing this. And he saw like a couple GI specialists over like 5 years. And one of them finally said, like, you have a young family. There's nothing wrong with you. Just go enjoy your life. And he finally went to a cash-based functional medicine provider and completely transformed his life, like removing like you have some sensitivities to this. We have some of this going on. Like, let's change that. Let's slow down when we're eating. Like, and he no longer has gut pain and it's like completely gone away. But that's because I'm his wife and was like, no, I can't keep listening to this complaining. Like, yes, I want you to feel good, but I also don't want to listen to this and you won't listen to what I have to say as your wife. I'm not your provider. And so I found him someone and it was like transformed. Like he used to not be able to do bedtime because he was in so much pain after dinner. And so like transformed our family dynamic. So it's like if you can find providers that fit what you're looking for. And what I have learned is I've gotten more and more into like the field of networking with other people that specialize. If there's something that's going on with you, whether it's pain or you're having sleep troubles or you're working with a myofunctional therapist with tongue stuff and eating habits and whatever, like whatever you have going on, there is someone out there, it might be hard to find them, that is extremely passionate on helping you with whatever condition you have or whatever thing you want help with. And going to someone that just kind of brushes you off is just you can do better. And I feel like when people start taking priority in their healthcare, I mean, having good health is what ultimately allows you to enjoy life, just empowers you in other aspects of your life.
Gonna say, kind of going into that too, I feel like on the female end, obviously they feel like in the profession and in the medical world right now, there's so much that's misunderstood about it. I don't think we know enough about the PCOS, endometriosis, and how young girls are at this point getting their cycle. I think there's definitely a lot of problems going on just from the start of a cycle for a very young girl all the way up until now menopause. And right now, women, like you were saying earlier, Jessica, is like women are finally in this transitional moment where we've had enough and it is exhausting to have to just fight every day for things that like we are all just miserable dealing with and it's not something you should have to deal with. Like these are things that should absolutely be addressed, whether it is a systemic issue. Hey, do we need to move more? Hey, do we need to change our diet? Hey, like all kinds of different things. What's your stress life, your work life, your home life? All of that plays such a vital role. And going off of like what Amy was saying, I think that's just a huge point in all of that is like, I think we've all just we're very frustrated with being blown off and not taking seriously and not being heard in our care, which can be extremely frustrating.
Yeah. And I think as women and moms specifically, we're not just taking care of ourselves, we're taking care of us, we're taking care of our spouses usually, we're taking care of our kids. We get to a certain point, we're taking care of our parents or whoever. I think that we can really change the tide in what we are requiring from our healthcare. And I think women specifically so often go unheard and uncared for just because we're taking care of so many other people, but like historically research in women's health has been lacking for lack of better terms. But I think that women can really change the tide in what we are requiring of our providers. And I think being able to choose people who align with what you're looking for, who listen to you, make you feel validated, and kind of give you more hope and in moving forward with, hey, we're going to figure this out, or we can work on this, and not just like it seems okay, come back in a few months and we'll see what's happening. I think that is really, I'm hopeful, the direction we're going to start going in.
Yeah, I feel like both Dr. Sam and I touched on that. Like, if we're not the provider to help you, like, we're not gonna be like, sorry. Like, we're gonna find someone that can help you and we're gonna check back in and make sure it's actually helping. Or we're gonna collaborate with them or find something like, I mean, there's not all conditions are we the source of answers, but we've built connections with people to get you connected with someone, or we know someone that might know someone that specializes in that, that can help you find the answers and just kind of be that like quarterback to like help coordinate the care between different people. Because we're invested in you, you're invested in us. Like we're gonna make sure that you get some kind of answers or some kind of support.
I also feel like too, like with Amy and I both, like us owning our own businesses, like we truly like care, like we really like want our patients to feel welcome when they come in, feel comfortable. And it's not just like a number and a patient in a system. You are truly like coming to like our baby, our home that we've put so much, work, effort, and time into. And we want to make sure that everyone that comes through that door feels that feels like family to an extent, obviously within reason, but they just feel very welcome. And it's not white stale walls, chairs lining the room, and you sitting for like 30 minutes to an hour for an appointment. That's 5 minutes, and then you literally spent more time in the waiting room than you do with your provider. So I think, like you were saying, we just truly like I think having more care into it because we also it is our livelihood and our family's livelihood, and we want to make sure that everyone feels just accepted and welcome. And we care so much that I'll stay up late at night researching things because I can't go to bed because I need you to get better, or I need to find the person that's going to help you get better.
Yeah, I think that there's really something to this like community of providers who are like all in, all invested. We all met through a birth provider group. I know all of those women in the group are like, hey, if I'm not the person for you, let's find the one for you. And I love this idea of kind of like getting rooted back in community and really caring for each other and helping everyone else get to where they're supposed to be. We had a message in the chat from Tanya. She was saying that she had a potential new patient who's a nurse and was saying that she totally understood the cash-based and is seeing that a lot more in chiropractic and PT. And I mean, as a nurse, you're working under insurance as well. So I feel like they get it from a totally different angle, but still under that same umbrella. Ashley made a great point that with this like go, 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 quick insurance-based model, patients are walking out of doctor's offices without asking all the questions that they had, or I've definitely had that experience where I have a laundry list of questions and my first two questions were like invalidated or barely answered. And I'm like, all right, let me close my notes app. I'm not going to be asking any more questions. But I think that's a great point too, to like, you have questions, you should get answers, and finding the right providers are going to get you where you need to go. Well, anything else to wrap up about cash-based model, about finding providers that are right for you, anything that you can think of that you want to mention before we wrap?
I feel like moms are just such a foundation of the family, society, and just being able to support them and help them feel like they can stand tall and like feel good in their own bodies is so important. I feel like some people find taking that time for yourself is indulgent, but it's foundational for our society. And I feel like women taking care of themselves in whatever capacity that they need that taken care of is just so important. And I know personally, I love being part of that journey, and I'm honored to like be able to share that space with moms.
Yeah, I would agree. Same thing with me. I think the biggest thing that I enjoy about my ability in what I do in our office, I know it's not always feasible for every office, but the fact that my moms can come in and get care and their kids can run around the office. And I just took a video today right before this where my office was an absolute mess, books off the shelf, toys all over the floor, and utter chaos. But the fact that the mom can come in and get treatment, and for me personally, I can allow the kids to be in the room while I'm there, I think just also opens the door, because I think a lot of women are not getting the care they need because they aren't able to bring their kids with them. And I know it's not conducive for every profession. I know there's limitations to it, but for me, I'm so honored that I'm able to provide that. And yeah, the office might be a little chaotic in that moment. I might run a few minutes behind because a kid threw up, like, pooped and they had to change or whatever. But I'm honored that I can make sure that those women can still prioritize themselves while they're having kids and while they're getting acclimated to one, two, or three more along the way. Because I feel like that's one of the biggest complaints I hear too from my patients is like, I couldn't go to care because I couldn't take my breastfed baby who only breastfeeds, and I can't leave them for unfortunately more than like an hour or so at a time. And it's just not conducive to that. Then they go, oh, I guess I'm just not going to do it. And then they miss out on care. And then years down the road, they're having these immense problems, especially on the pelvic floor side, that can be extremely frustrating. And they just never got to address it in a much quicker time format.
Yeah, to your point, I feel like in my small space, I try to be as accommodating. I've had a mom bring her little girl that was 3, and she had so much fun. She's like, "Are you coming with me to my next session?" I was like, "No, no, this is my therapy. You can come with me." So I very much the same. Like, I mean, when you work with moms, you have to be, well, if you can, being accommodating, having the toys, having the bouncy chairs, teaching a little one how to use tape when they plaster pictures all over your walls. Like, it's great.
It's a chaotic, organized amazingness.
Yes.
Yeah, I've loved seeing Dr. Sam post. She's like baby wearing someone's baby while adjusting. It's the best.
Yes, he was very unhappy in that visit, and mom and I could not set him down. And I was like, you know what? I refuse to have you leave and not be able to get treated. I was like, you brought your carrier in, right? And luckily it's a good friend of mine. So I was like, take it out. Let's try this out. I was like, I've been wanting to actually give this a try to see if it's conducive to my actual patients. And he was asleep the whole video, dead asleep the whole treatment, just nuzzled in there. And I was able to get a lot of things done. And then, the last 2 seconds, I set him down for a few things I wasn't able to do while I was baby wearing. But it was just one of those situations where I was like, we've got to get creative. And sometimes you just pull out all the hats to figure out how can you get them to, be happy, calm down so that mom can truly get what she needs. Because at the end of the day, like you were saying earlier, Jessica, moms do a lot in the family, typically taking care of a lot of people, food on the table, all the things. And it really hurts me that moms typically get so neglected in care and, brush it off because they have so many other things to deal with.
Yeah. I love that. Well, thank you guys both so much for being on. I could talk forever about the insurance world and the positives of cash-based, but I appreciate you guys spending your time sharing more about it, educating a bit, and showing some of the benefits. If you wouldn't mind sharing where people can find you, social media, website, whatever you'd like to share. Amy, do you want to go first?
Sure. You can find me on social media on Instagram or Facebook at Chicago Mama PT. And then my website is Chicago Mama PT. You can find me there.
And then for me, you can find our clinic on Instagram and on Facebook. It will be thehive.wc. And then our website is also thehivewc.com. But yeah, same thing.
Thank you for having me. And I'm always happy to do free consults too if patients are trying to figure out if this model is right for them.
Same on my end.
Yeah, I was going to say, if people have any questions after attending the live chat or listening to the episode, I know you guys have your DMs open and would love to hear from people. Awesome. Thank you guys so much.
Thank you.
That's it for today's episode of the Mama Making Podcast. If this conversation resonated with you, share it with a friend, leave a review, or follow us on social media. We love hearing what's landing for you. And most importantly, keep making your way through. You're never in this alone. Thanks for being here, and we'll see you next time.